Welcome to TSU Human Performance Sports Science Podcast, where we dive into the fascinating world of sports science and innovation, right here at Tennessee State University.
We are your hosts,
I'm Neil Monet
and Franka Sindicic, and today we are taking you on an exciting journey to educate, entertain, and keep you up to date of happenings right here on our campus.
In each episode of TSU HPSS, we'll bring you exclusive interviews with our expert faculty, coaches, student athletes, and our students from our departments who are making stride in this field.
You will gain the insights into the latest training techniques, nutrition strategies, and sports psychology breakthroughs that are now shaping the future of sports performance.
All while bringing it to you from an HBCU perspective. What's up, everyone? Welcome back to our TSU HBSS podcast. Our new guest for today is Trevor. What's up, Trevor?
How are you doing?
So Trevor is going to introduce himself, let you know, guys, what he's doing at TSU and everything great about him.
So good morning, everyone. My name is Trevor Searcy. I'm Director of Sports Medicine here at Tennessee State University. I've been here since 2015. While I've been here at Tennessee State University, I've worked with every single sports team on campus at one time or another. Had a great time doing it. I love Tennessee State University, and I love what I do here. Prior to here, I worked in Jackson, Mississippi. I had a sports outreach in Jackson, Mississippi. Prior to that, I worked mainly at Middle Tennessee State University. I'm also an alumni of Middle Tennessee State University. I did all of my athletic training classes and courses on campus at Middle Tennessee State. Go Blue Raiders. I don't think I've changed much. I stayed in the Big Blue family with Blue Raiders, Tigers, and I love what I do.
I want to talk about your journey. So what made you want to be an AT for us?
So growing up at my high school, I really didn't have an athletic trainer. I didn't really know what one was until I got to a junior college, and I met my first athletic trainer while at junior college. I began to shadow that athletic trainer, and then I'd had several injuries myself. And after shadowing that athletic trainer, I decided that's what I wanted to do for my career field. And that from that junior college led me to Middle Tennessee State.
Did you have any internship that helped you along the way?
Yes. So every summer while at Middle Tennessee State, I would go somewhere and get an outside internship, whether it be NFL internships or whatever that looked like. Also, while you're in an athlete training program, you're required to do clinical hours each semester. So by the time that you graduate, you have well over 1,000 clinical hours of internships. And that's not including whatever you do externally outside the university.
So during your internships, did you had the inpatient and outpatient as well, or just one of those?
So as an athlete trainer, we mainly focused on the outpatient side of things. I did an internship with National Healthcare in their clinic, which was a PT clinic in Murfreesboro. Usually athlete trainers do not do much with inpatient rehab. Our athletes will go, even like ACL surgeries that are in-depth surgeries, they're still outpatient surgeries. The athlete usually goes home that day.
So now that you made it as a AT at TSU, what would you say is the biggest thing about your position right now? Because we had JP in our podcast, and I would presume that you have more experience than him. And I'm not sure how it works if you're ahead of him or anything like that. But I want to know, how do you deal with your staff, and what's the most challenging part about your job?
So one, you said made it as an AT. What does that really mean, though? I mean, you never really, it's not an end goal to make it as an AT because you're constantly learning. The field is always evolving, and so we're required to do continuing education hours. But also to answer your question, JP is phenomenal. He was one of my students here at Tennessee State. He was. He worked football with me here for 4 years at Tennessee State. And he was actually one of my first ever students here at Tennessee State. He was my right-hand man for 4 years. But how that works with staff, each staff member is responsible for either one or two separate sports. Like you have Maggie Burton, Sasha Collier with football. You have Julie Martin that has volleyball and softball. JP has men's basketball, tennis. I work with football and track. So we do a good job of splitting the sports up. That way everybody shares their own workload. But I do manage the day-to-day operations of what goes on inside the staff and what happens with those sports.
Because you have to deal with football, would you say that your schedule is a little bit busier since there's so many more players in the team?
I would say this, mainly Sasha and Maggie Burton do a great job of managing football. And I love going over there and being around them and seeing them work. But they do a great job of managing the day-to-day operations of football. It takes a lot of work off my plate.
Since you're the director of the ATs in our school, do you have any additional paperwork that you have to do or anything on the side besides only helping the athletes?
Oh, there's always additional paperwork. There's always something to work through. There's an issue to work through. There's constantly trying to advance our staff, expand our staff, trying to provide a higher level of service to the student athletes. I think that's the biggest part of my job is always trying to push upper level administration and even on the university side of things, like push them to add more staff members, add more resources, add the hydration station. It's always a battle to push those boundaries.
I know, if I'm right, that a lot of students from HBSS department work as an internship with you as an AT. Is that correct?
That's correct.
How many spots do you usually have open, and what are you trying to teach them?
Currently, we have about 15 spots open with football. Well, 15 spots that are at football. They're not all open. We have 15 students that are over there. With the other sports, there's roughly 5 or 6. So we have between 20 and 21 student spots. Most of those are covered under work study. And the goal there really is to give them exposure to the field of athletic training. I saw early on with JP, because he was my first student, that there was a lot to be learned, the students, and you could identify students who had a real passion for athletics, and you could help steer their career and give them access to student athletes and sports that otherwise they would not have access to.
That is very true, and they kind of have the hands-on experience as well.
Correct.
So when you say also help them and direct them in the way they want to go, so are you also talking to help them what certifications additionally they should get and how should they educate themselves for the future?
Correct. So inside of our student program, students will realize that they either like working outside of the sports, they love the day-to-day operation of the sports, and some of our students realize they love the rehab side of things. So how that helps steer the student is some students realize they want to be athletic trainers, and some students realize they want to be physical therapists. So we've had students that were our students go to be athletic trainers. We've had students go to the physical therapy program here at Tennessee State University. One of those students is currently working for the New York Jets, and he is working as a PT for the New York Jets. Now, he didn't really want to be an athletic trainer, but he wanted the PT side of things.
And you mentioned CEUs, continuum education.
Correct.
Is that right?
Yes.
So how do you get them?
So attending conferences, attending anything that advances your knowledge in the field, and the National Athletic Trainers Association is what governs our profession, and they allot certain CEUs for certain conferences. An athletic trainer has to have 50 continuing education units every 2 years, and you have to submit those to the national portal. Mm-hmm. But like if you attend the National Athletic Trainers Conference, each year it's roughly between 20 and 25 CEUs. So if you attend the national conference and attend the classes and courses, that pretty much covers your CEUs. Mm-hmm. But there's all kind of ways to get CEUs. We're actually trying to host a dry needling course here at Tennessee State this summer to get our entire staff certified in dry needling. And that would give each staff member 17 CEUs.
Talking about those different certifications to be a little bit more specialized in different field, do you think that the more certification you get, the better, or do you think you should get better at one specific field and keep doing it? What would be a good way to improve in as an AT?
So if you look at our staff, each one of our staff members is certified or has knowledge of different techniques.
Okay.
You have staff members that have certification and knowledge of like the BFR blood flow restriction cuffs. You have staff members that have knowledge of Graston techniques, scraping, cupping. There's a vast array of different tools that an athletic trainer can have in their tool bag. But I think as an individual, it's good to expose yourself to as many of those courses as possible, because I think the more tools you have in your tool bag, the better you can treat the student athletes.
I know when I'm talking with you, you always mention mixed martial arts. So that is one of the sports we do not have. But can you tell us what were some of your injuries and how did you heal them when you were younger?
Through my athletic career, I've had an array of injuries from ruptured bicep tendon, ruptured pec. I've had 6 shoulder surgeries, 2 knee surgeries. So I've had, you name it, I've probably had it at some point.
Okay, I'm asking this because I always think that it's way easier to understand the athlete if you're an athlete yourself. So it's very easy to understand them and talk with them that everything is going to be fine, especially if you have this much injuries and you are still here, still active, because I know I see you in the weight room probably every day. So that's great. And I wanted to ask you, what is your favorite sport to work with?
I wouldn't say I have a favorite sport. I think I find joy in every sport. Because I sympathize with the student athlete. I understand the student athlete, what they're going through. I think the newest sport for me to really identify with has been track and field. I went to OVC Outdoor Championships. I worked OVC Outdoor Championships here in 2015. We just had indoor championships. But it amazes me with those athletes, some of the things that they can do, speeds they can run, how high they can jump. Now, I grew up playing football. Have exposure to football and basketball. So I think not necessarily being sport specific, but just being there for the student athlete. Some athletic trainers are very sport specific. They only want to work certain sports. I think in the grand scheme of things, we're here to provide a service to student athletes. As long as we keep that in mind, it works best for everybody.
That is true. And I know when we were talking with JP, I think he mentioned his favorite injuries to work with were somewhere around the shoulder, and I think he said lower back. So do you have any specific areas that you would just love to work with and study about them and learn about it?
For me, the shoulder, and that comes from my own injuries. I think athletic trainers are more comfortable working with injuries they have a good knowledge of. And as a staff, we're really good about, like, staff members will ask me to look at their athlete's shoulders, and we'll ask JP to look at other athletes' lower backs. And so we're really good as a staff about bouncing ideas off of each other.
With you being also an athlete, I know that injuries, you cannot really pick them and they happen if they have to. But what did you do in order to prevent the injury, and what would you recommend to our students and student athletes to do to prevent injuries? Is that sleep, diet, or stretching? What is your opinion on that?
Well, obviously your diet and your sleep routine have to be in place as big injury prevention measures, but also being cognizant of what are your weak areas. As an athlete, if you understand and accept your weak areas, you can turn your weaknesses into strengths. I think you have to be mindful of that, and that's a good starting point. Obviously, you can't prevent all injuries. Some injuries just are going to happen. If you're going to be an athlete, you're going to get injured at some point. I think being able to mentally accept that helps you when you do get injured, because once you get injured, a lot of times the body will physically recover before the mind recovers. So a lot of times if you're looking at a major knee injury and you rehab the injury, your body gets stronger and your body will respond, the muscles will get stronger, but the athlete still has hesitations in their mind about coming back to play. And a lot of times you have to convince the athlete that they're healthy enough to come back to play.
So you mentioned that it's important to recognize our weak areas. So how would you say to athlete, how can we recognize that?
A lot of recognizing your weak areas are just being honest with yourself. Because as a high-level athlete, like both of you are very high-level athletes, you're elite-level athletes, and you're mindful of what your weak areas are. whatever that is, whether it's a weak swing, whether it's a weak step, a weak quad muscle, a weak glute. Most athletes, by the time you get to this level, you're very mindful of what those weak areas are. You just have to be proactive in treating those weak areas, correcting those weak areas. I mean, even as small as gait analysis and how an athlete runs, it all plays into what are your weaknesses as an athlete.
So let me bounce on that real quick, because I do believe that strength and conditioning are really part of the recovering part, and any type of injury can or could be fixed a little bit with strength and conditioning. So I want to know what are your relations with the strength conditioning coaches here at TSU, and what do you think about the involved the coaches being more involved into your job?
So we have a great relationship with our strength conditioning department. Coach Sopp and his staff, they get daily injury reports from our staff on injury updates. Obviously, I'm in the weight room every day I give them updates in person. Go down and talk to them, and we're constantly altering, changing. Somebody that you can't do certain lifts, we try to make adjustments to their lift. So I think this staff does a great job of working with me and my staff to make those adjustments, make those corrections. And they're very open to our input, and we're very open to their input, because they're going to see things in a weight room that we don't see. And also my staff, we try our best to have somebody in the weight room during lift.
Okay.
Like if somebody is free during lift time with their sport, they'll go down to the weight room, watch their sport lift, because athletes move differently in a weight room than you move on a court.
Right.
And you might be able to identify a weakness in a weight room easier than you can in the court, and vice versa sometimes.
Yeah, because you kind of break up the movement that you're going to do on the court later on. Right. I see.
But I'll also give you this one too. Remember this, when it comes to injuries and strength conditioning, as strength coaches push the boundaries of getting bigger, stronger, faster, they put more force on the athlete's muscles, joints, tendons. And the more force you put on those things, I mean, the human body can only take so much.
Right.
And as you look, even in professional sports, as these athletes get bigger, stronger, and faster, they have more and more severe types of injuries.
That makes sense. So later on, when you after your career, do you think that just to prevent injury, you should keep lifting, but in a way that's just to maintain?
Oh, absolutely. But I mean, let me ask you this now: as an athlete, you're competitive by nature, correct?
Right.
Do you ever think you yourself? I'm gonna ask you: could you lift just to maintain?
That would be super hard. That would be hard. I would be annoyed about lifting the same amount of weight every single day, or like not seeing any progress. But then I'm glad, because sometimes I don't want to focus on being faster, being stronger, but I focus on being healthier. Like that's also kind of an improvement. And as being competitive, me seeing that my knees getting better, I'm already so happy about it. I'm satisfied by being healthier in a sense. Or it could also be my mobility, be it go lower or go deeper in my stretches. But any kind of thing that is related to health, I kind of take that as a win, and then I put away the strength part or the explosive part. But that's after a career. Like as an athlete right now, I don't want to take that away from me. Like I want to keep being more explosive, be more powerful. But I think in the future, I would focus more on like all those healthier part that you could focus on during a lift.
Oh, I completely agree. I think the natural progression for almost any elite level athlete is you progress from your focus in the weight room is getting bigger, stronger, faster, more explosive. And then as your time with sports comes to a conclusion and you move into normal adult life, your weight room focus transitions into, the weight room is just part of your lifestyle.
Right.
It's part of your lifestyle to maintain being healthy. It's part of your lifestyle to watch what you eat a healthy breakfast, be cognizant of your nutrition. I think most elite level athletes, that's a natural progression for them.
Let's come back to your job. I want to ask you, as an AT, how do you improve in the field? How do you how do you get to another step? Is it by focus on your education? Is it by being getting more experience in the field? How do you get to the next step?
So when you say next step, what do you mean by next step?
That's a good question.
Let's define what the next step is.
The next step, I think what I mean by that is going from, let's say you going from a high school to a college level to then a professional level. It's still the same job, but to me, it's the next step in a sense where like you getting from very elite athletes, in my opinion. So how do you get there?
So I think early on in your career, I mean, before the point where I'm at, athletic trainers identify they either love the high school setting, they love the clinic setting, they love college, or they love professional sports. So I think early in an athlete trainer's career, they've identified where their heart is and where they want to work, so to speak. Like, I love college athletics. I've always loved college athletics. I've had exposure to professional sports. My mentor was head athletic trainer for the Tampa Bay Bucks for 20 years. So I've been around a lot of NFL sports, but I've never wanted to work NFL sports. I've always wanted to help the college athlete.
Right.
So can I ask, why do you like college, and why would you not like to work with the pros?
Oh, absolutely. So I got into athletic training to help the athlete, and I wanted to be the one to help the athlete myself. Your shoulder dislocates, I want to be the one to put it back in. Your finger dislocates, I want to be the one to put it back in. When you're in professional sports, you're still an athletic trainer at a very high level, but you have a ton of physicians that are standing right beside you, and those physicians will do those things for those athletes. So you become more of a middleman that's managing what the athlete does, and you're not practicing as much of the skills of an athlete trainer. We get a chance here to be more hands-on with the student athlete, and then as I sit back and look at it, if I was an athlete trainer for an NFL club, am I the one really helping that athlete? Am I really making an impact on that athlete? And versus my time here, am I really making an impact, or do I have the ability to make an impact on that athlete? And absolutely. And here in a college, you can make an impact not only with the student athlete, just with like look at JP. I have impacted my career field with JP because he met me here at Tennessee State as a student. He wasn't an athlete, and now he became an athlete trainer. Okay,
so JP being your student, you did a very good job with him, because I honestly love JP. I'm going to tell you actually the funny story, because at Tennessee State we were kind of liking the athletic trainers. You did a great job picking JP. We love him, the whole tennis team. So he's showing up at our practices, and we never had that. So we were running around, and the girls were like, why is he here? And I'm like, well, that's actually his job. So we were like, every time he comes, we're like, thank you so much for coming. And he's doing a great job. Like yesterday, he was doing the exercises with one of our players, Scooby. He's really dedicating and asking us how are we feeling. He's watching us practice what you said. He's really watching our movement. So yeah, you did a great job with him. So my question for you is like, what would you recommend to the students now? Like, what should they focus on? What should they look for in their internships, and how can they improve every day to become an AT?
I would encourage the students to just get involved. Just get involved with athletics. Like, come see us in the athlete training facility. Come meet the strength coaches. Come meet the athletic trainers. Come spend time around athletic events. Come to tennis matches. See what the athlete trainers do. Come get involved. The hardest step is the first step.
I agree with that. Do you have anything else to add?
I do not. He said it. He said it all.
Do you have any question for us?
I don't think so.
All right.
He knows us well.
I do. But I'm very happy you guys do love JP. That pleases me to hear that. I'm excited to hear that.
And it's also, see him coming to the courts is also showing us that TSU is also improving, that you're really trying to look high quality trainer. So that is what, like, when I see it, I'm so happy about it, because I see that we're all moving forward. Also the ATs, we as our department, we're all trying every day. We're seeking to do something new and to improve.
Correct. That's the goal. Keep pushing the boundaries and keep improving.
All right, Trevor. That was a pleasure to have you. I hope you're gonna stay at TSU for a long, long time, and JP as well, and all your stuff.
Thank you guys very much.